Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Hamley. I'm pregnant. For women, those words can evoke joy, excitement, and wonder, or dismay, anxiety, and distress, depending on the circumstances. But regardless of circumstance, for Black women, there's another very real fear: death. According to the Centers for Disease Control and Prevention, Black women are 3 times more likely to die during pregnancy or in the first year after birth than white women. The question is why? Some answers on today's Another View on Health. Plus, it's that time of year, y'all, our spring membership drive, the time when you show your love for Another View by becoming a member of WHRO Public Media. AV producer Lisa Godley and phone producer Dr. Barry Graham are here with me to ask for your support. Hey, y'all, how you doing?
Hey there. Hey there. You know, you had us in here, and the way you started that tease, we were like, what?
We just fell into each other in here cracking up.
You know what? I know. I'm glad Max is not like driving or something because he probably run off the road. Oh, gosh, but we need you guys to call 800-940-7170. Make your pledge of support for Another View in particular, but for all the programming that you hear on WHRV-FM. We do have a $2,000 match, so that means that every dollar you give between now and 1 o'clock will be matched dollar for dollar up to $2,000. We always go way over our goal, and we're counting on you, our Another View listeners, to take us over the top again. Isn't that right, Lisa?
Absolutely. Absolutely. Then you will hear a couple of numbers throughout the show. One is for you to call in and be a part of the conversation. The other is for you to call in and pledge your support. And we are hoping that you will call in and pledge your support. Think about all the incredible shows that we've brought you over the years and all the things that you've been able to talk about. Yeah, 15 years, all the things you've been able to talk about with friends and things you've learned. And we could not do that without you, our supporters. So we just ask you to pick up the phone, give us a call. You can go online and pledge your support there if you don't want to talk to a person. But we just... we want you to be a part of our family and to join in.
And, to make it easy, Barry, I'm coming to you just a second, but just to make it easy for our listeners today, for the show, if you want to call in to talk with us about Black Maternal Health, we're only going to give the local number. And that will keep it from being confused with the number that you will call in to make your pledge of support, which will be an 800 number. What's that number, Barry?
The number to call in, 800-940-7170. That is for your pledge of support. That is the 800 number. That puts you into the Pledge Central, and you can talk to the volunteers. Or you also can go online. That takes you just a few moments, WHRV.org.
Absolutely. And Barry, what do you think about the show and what we've been doing lately? Did you listen last week when we were live at Yorktown?
Absolutely. Did I listen? Of course, I was missing it. I was here in the studio. I was engineering it here in the studio, but I was glued to it. And again, I say this each and every time that I'm so proud and privileged to be a part of this team because I love learning. And as an old social studies teacher, I could not have had a better hour than last week during the program. So thank you.
750. See, there I go.
Be careful.
1-800-940-7170. That's the number to call. Also, I want to talk to you about a book and an opportunity that's very, very cool. I am currently reading called Black Out Loud, The Revolutionary History of Black Comedy from Vaudeville to 90s Sitcoms. Now, it's by Jeff Bennett, and if you are a PBS fan, you know who he is, the co-anchor of the NewsHour, and he has written a book, and it is wonderful. If you like history, if you like comedians, if you want to know how comedians help change the social landscape in our country, you really want to get this book. Now, we have an opportunity. If you make a one-time donation of $150, you will get a signed book, signed by Jeff, and then you can also attend a virtual book talk at 7 p.m. on April the 15th. So you can get online, have a conversation with him about the book. get a signed copy of the book. That is for a one-time donation of $150. Have you read it, Lisa?
I have not. I'm waiting for you to finish
Yes.
I read a little bit of it on Saturday morning. I was in kicking off the pledge drive, and they had a copy of it back in Pledge Central, and Dwight Davis and I were fighting over it. Okay. He was reading it, and then I took it from him. So, man, it's a great book. It really
is a fantastic book. And I mean, it takes you from the very beginning with Billy Kersands and minstrelsy, which I had to learn how to do and say, and through Burt Williams, George Walker, Stephen Fetchit, Hattie McDaniel. You know, everybody knows her from Gone with the Wind, but did you know that she was a comedian? Amos and Andy. I'm currently reading the chapter on Bill Cosby. They've got Richard Pryor, Eddie Murphy, the sitcoms from the 90s, A Different World and Living Color, Family Matters, etc. So it is a great book. $150 for that pledge of support. 800-940. Nope. Did I do that right? 940-7170. That's it. 800-940-7170. The number to call. Stay tuned. Another View is coming up in 5, 4, 3, 2, 1. Here we go.
Discussing today's topics from an African American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamley. It's our spring membership drive, the time where we come asking for your support of Another View and all of the programming you enjoy on WHRV-FM by becoming a member. If you call between now and 1 p.m., your donation will be matched dollar for dollar up to $2,000. So give us a call now at 800-940-7170 and tell the volunteer that you love Another View. Today is Another View on Health, and our topic is Black Maternal Health. We have some outstanding guests with lots of information on how we can help Black mothers have successful pregnancies. Dr. Lindsay Spiro Robbins is the Assistant Professor of OBGYN and Director of the EVMS Center for Maternal and Child Health Equity and Advocacy at Old Dominion University. Hey there, Dr. Robbins.
Hi. It's a mouthful, isn't it?
Absolutely. Thank you so much for joining me today.
Thank you for having me.
Teresita Hammond is a registered nurse and community outreach coordinator at the Centera Norfolk General Hospital Family Maternity Center and team leader for the Black Maternal Health Equity Alliance Conference. Hey there, Teresita.
Hey.
Thanks so much for joining us. And Benita Evans is a community, family, and maternal health advocate. She's the Healthy Resource Specialist with the UP Center in Norfolk and chairperson of the Consortium for Infant and Child Health Black Maternal Health Equity Alliance, Action Alliance, or BMHEAA.
Or BEMA.
We're going
to call it BEMA. You will never hear the rest of those letters again.
Thanks so much for joining us, Benita.
Hi.
We appreciate you. And, of course, the man of the hour, head of cardiology at Bon Secours, co-host of Another View on Health, and Peggy Newby's husband, Dr. Keith Newby.
Well, listen,
I had to give my girl a shout out.
Yeah, nothing wrong with that. So I'm glad at least their titles are a lot longer than mine. So I don't feel so bad anymore.
Believe me, I could have put a whole other stuff in there for you too, sir. I don't know what it is about you medical folks, but y'all got long titles.
I know. I work hard to get them titles. Don't take them away from us now.
That's a very good point. All right, I want to start with you, Dr. Robbins, because I want to go to the science. Because here's my question. Is there anything biologically, genetically, physically different about Black women that from other women that would cause such a disparity as we're seeing?
No, we certainly can't explain these numbers by thinking of races as different inherently. So I absolutely don't think that's
so
where
all the
we
plumbing,
need to be
everything,
looking.
all of that, the physical part is all the same.
Yes.
Okay.
We
all
need
right.
to be looking at all the factors surrounding our patients that are having an influence on their health.
Okay. So what we're talking about more so is the socioeconomic, social determinants of health, those types of things that are going on. So Benita, tell me some of the me some of the areas where there is the disparity. I mean, that statistic of Black women 3 times more likely to die in childbirth or during the first year after birth. Why is that?
I think some of the easiest ones to know. We know financially most Black people tend to live in poverty, but we know also those statistics don't even they extend across financial borders, right? I think the biggest one we're seeing is that our cultural experience within healthcare and a lot of systems is very different. We could go back to systemic racism, and I'm going to say everything is a result of systemic racism. And systemically, it has been, we are always kind of put at the bottom of the barrel, and it feels that way, and that is how we then interact with the system and how the system interacts with us. I think, like, you could say financially, you could say how we deal with stressors, you could say how we understand the system, or our ability or access to the systems is affected at literally every area, because we think about the ACEs, from trauma to exposure to substance abuse, like all of these things have great impact, and now they affect the way that we are able to engage in a system that has significant impact on us.
Tara said the whole image, and I'm coming to you, Keith, but the whole image of the strong Black woman. I mean, if you look back at old movies and so forth, what do they show you in slavery times, and then during Jim Crow, the woman would have the baby and then she's back out in the field picking the cotton. And I mean, that whole idea of we don't have pain, or we don't we deal with it, and so forth. Is some of that inherent and causing an inherent bias that some in the medical field and others may feel, well, they're different, so we're going to treat them differently?
I think it is, unfortunately, and I think it needs to be broken down, because we're not that resilient. I heard just like you heard. I am trying to make it day by day just like you are, and it needs to be broken down. We need to stop using the strong Black woman, I think. We need to stop doing that. We're all here just trying to make it.
Exactly.
So, I think it also stems into, getting into my public health background.
Yes.
It goes to a lot to social determinants, which they've alluded to. Also, though, and I think you were involved with my sister's study with the highway issue and the pollution that comes off that. And a lot of these highways were built through African-American neighborhoods. So then you don't have sound barriers, all these things that have been brought up. So if you look at a small particulate matter that is released through combustion and gas cars coming through, think about what that's doing to our bodies. So if you're in a neighborhood that you're exposed to this on a regular basis, it does take its toll. So it's a host of things, from systemic racism to exposure to financial. It's a whole host of things. And then you had to get to the trust factor, which was alluded to earlier, which I definitely understand. That's why I'm such a strong advocate in our community, because I think we have to have individuals who people can trust, they feel they can talk to, and they feel that relate to them, because otherwise you put the wall up. If I could tell you how many times you meet somebody, how you doing today? I'm fine. Always I'm fine. Then as you dig, they get comfortable with you, then all of a sudden things start coming out more. But we as healthcare professionals have to create that environment that will allow people to feel open and free to have those discussions. I've seen tons of women who are pregnant that never even see a doctor until down the road, and it's for multiple reasons. Access. So you talking, we could go all day long with it, but I'll let you take it up with that.
Well, but I find it very, very interesting that from a socioeconomic perspective, those women have issues also. I was reading an article this morning where they were saying that there was a study done in California where the most wealthiest Black woman still had worse outcomes in terms of pregnancy than the poorest white woman. And so you can't say it's economics or we don't go to the doctor. So what other things are you seeing, Dr. Robbins? And do we wait too long to start with the prenatal care? What's happening?
I think that's a great point. And just to piggyback off of that, another thing that we've seen, not just with wealth, but we've seen that with education as well. So I think it was out of New York where the college-educated Black women had a higher risk of death due to pregnancy than a white woman without a high school
Without a-
education.
yep, exactly.
So you're right. We are saying that so much of this hinges on social determinants of health, but that doesn't tell the whole story, right? It's very complicated. And so I think that you brought up the point of, are we waiting too late? And I love all the emphasis that there has been in the last several years about improving care during pregnancy and the birth hospitalization. But I think you're right. We've got to go before that, before the patient's even pregnant, or right at that first pregnancy test, before that die is cast, right? I mean, we've got to, I would love for us to have more of an impact preconception.
Absolutely. 757-440-2665 is the number to call to join our conversation. So if you'd like to talk with us about Black Maternal Health, 757 the number just went out of my head. 757-440-2665. That's the number to call. I want to talk with Tara from Virginia Beach because she has an experience with her pregnancy, your second pregnancy, if I'm not mistaken. Tara, is that correct?
Yes, that is correct.
How are you this morning?
Hi, I'm doing well. How's everyone doing today?
Good. Okay. So according to the notes that I was giving, that you have a master's of public health, you work in the healthcare field, and that your first pregnancy was smooth, but the second one was more challenging. Can you tell us about it?
Absolutely. So, of course, as you already mentioned, I'm a proud mother of two, and my journey through motherhood has been both beautiful and challenging, I must say. Like you mentioned already, my first pregnancy was a lot smoother, but my second, I experienced it really opened my eyes to some serious gaps in maternal care. Here I am. I have my master's in public health. I know what to do. I know how to advocate for myself. I know the steps. I understand. I'm knowledgeable, which I've heard you guys mention before, but from the moment I arrived at the hospital, I felt dismissed. I was treated differently, right? And even though I clearly expressed my concerns, because I'm like, the contractions were coming, it's extremely fast, and this was not my first rodeo. And I'm like, they're saying you're 3 centimeters dilated. And I'm like, I feel more than 3, but okay. So even though I clearly expressed my concerns, the staff really brushed me off. And they really rushed me, and I feel like they really didn't take the time to explain what was happening or why, because even though I know what's going on for most of the, they should still explain. They don't know what I know, right? They treat everyone the same. So they really made an already vulnerable moment feel like I felt more isolated, essentially, right? So I'm having these issues. They're not, addressing them, and then they're like, okay, let's just go ahead and get you your epidural, right? Maybe that'll calm her down. It's probably what they were thinking. So I went to get my epidural, and as they're giving me the epidural, my water breaks instantly, and I start to crown. My child, my daughter's coming out. So the first thing I'm thinking, they tell you can't move. And here I am, I can't move, and I'm giving, I'm giving birth, like that, in labor, in active labor.
So the baby was crowning as you were getting the epidural?
That is correct.
Wow.
So immediately, I will commend the anesthesiologist because they saw what was happening. She immediately did all that she could to stop the process and, get me to where I was able. She hit a button and everyone flew in. But my delivery, although I felt at ease after that, my delivery became more complicated and overwhelming because I knew something afterwards still was not right. So I was able to give birth to my daughter. She was healthy. She was full of fluid, though, because she came really, really fast, which was fine. But because I've lived in my body, I know what feels normal and what doesn't. And I voiced my concerns multiple times after birth. This was 24 to 48 hours afterwards. I started to get a fever. And this was during COVID, the height of COVID. My daughter was born in 2020. And I remember instead of them properly evaluating me, they said, oh, it could possibly be COVID. That's fine. That's been happening often. And I'm like, well, I didn't get a COVID test to see if that was COVID. No test was given. There was no additional steps that were taken to figure out what was actually wrong. So I was left feeling, here I am with a fever. I couldn't even, try to latch my child on to even breastfeed. I didn't even want to hold my child because I'm in this extensive pain. And it was to the point where I'm having to ask them for, heavy medication. And I'm like, wait a minute, something's wrong. It wasn't like this when I had my son. So at that point, I felt completely unheard and unsure of what was going to happen next. But thankfully, there was a midwife that I recognized from just previously, being involved in the community and just previous roles that I've had. I've worked in the OBGYN office, the whole 9 yards. And she saw that I was in distress, and I literally begged her. And she stepped in, and she took the time to really listen to me, and she validated what I was feeling, because all the other doctors and nurses would completely blow me off. Like, oh, you just gave birth to a baby. And I'm like, but I have a fever. I'm shaking. I'm sweating. I can't, something's wrong with me. So she advocated on my behalf, and she made sure that I received further evaluation, including what was an emergency ultrasound. And that decision made all the difference. The ultrasound revealed that I had retained placenta tissue, which required immediate medical attention for them to get that out, because it could have become life-threatening if that would have continued to go unnoticed. So I truly believe that if she hadn't stepped in, my outcome could have been very different. This experience changed me so much and was so traumatic. I didn't have any more children afterwards, but it really showed me how critical it is for healthcare providers to listen to mothers, especially Black mothers, and take our concerns seriously. We deserve to feel safe. We deserve to feel respected and heard during one of the most important moments in our lives as women. So maternal health isn't just about delivering babies. It's about listening. It's about that trust, and it's about that timely care, because being heard can truly be the difference between life or death.
Sarah, first of all, I'm glad that you're okay, and I'm glad that your children are okay. And I'm looking at the faces of our guests here on set, and I'm going to let them respond. But clearly they understand your concerns, and maybe we'll have some other advice for other women who may be going through this. Thank you so much for sharing your personal story. We really, really appreciate that. Teresita, so she had a midwife that she recognized from the community. What if you don't have anybody? What if you don't know anybody? Yeah. How do you advocate for yourself?
If you are in the hospital, you ask for a charge nurse. If the charge nurse doesn't listen to you, you ask for a patient advocate. There are people in the hospital that will advocate for you when you cannot advocate for yourself. The most important thing is exactly what she said. You want to be seen, heard, and believed. And that is the problem. People are coming to the hospital. They're getting doctor's appointments. They're doing all the things that they need to do, but they're still not being believed when they say, I'm in pain. There is something wrong. And I always tell my patient, you know you better than I know you. I'm just coming in. I'm here for a brief time. If you tell me that something is not wrong, something is wrong, I'm going to try to figure it out. I'm going to advocate for you. And I'm going to keep pushing until we've exhausted all the possibilities or we figure out what is going on. And that's the thing. You have to have people advocating for you, especially when you don't even know what to ask, what to say. Have to have those people there.
Dr. Robbins, and I'm going to ask both of you and Keith, since both of you are MDs, but what kind of training in today's world, because I'm going to assume both of y'all kind of came through school at little bit of different times, perhaps. I don't know, but
that's a courteous way. She don't want to call me old in front of you guys, so that's what that's about. But I appreciate that nonetheless.
You got me.
Yeah.
Okay, but
thank you.
but what kind of training today, Dr. Robbins, are student nurses, doctors, whoever, healthcare workers in general getting, because I keep hearing this issue of people not being heard.
Right. So I think that's tricky to answer, because I'm sure every institution's a little bit different in terms of what education they offer and what vehicles they get that information to their students.
So there is nothing uniform across the medical the medical school field in terms of how they're trained?
No, not that I'm aware of. Not that there's a single curriculum that is rolled out at every medical school or every nursing school. Are you aware of anything? Yeah, me neither. So I think it probably looks a little bit different in every place, but that can look like, so at EVMS, for example, we have in our department implicit bias training for our team. The medical students have a health disparities lecture each spring focused on maternal health, and I'm sure that they have other areas as well. I'm just immediately familiar with that one. And so I think it just highly varies depending on place to place. Do you all, about your department?
Same difference. I think what I have come to this conclusion is that, and I know this is going to sound kind of bad, but it's really a lot of it depends on how your mama and your daddy raised you.
Yes.
I mean, I hate to say it just like that, but I think if you have an empathetic heart, it carries into your career path. If you don't have an empathetic heart, it doesn't, because I don't know how you can't really teach empathy. Right. That's something that's intrinsic to each person. I know when I was at EVMS, because years ago, but when I was...
I was trying to be nice.
I know, but I'm just going to keep it real. Listen, I'm blessed to be here. I take it to roll with it. But they did push that in school as to training on how to listen. And one of the things, my older brother, who is a physician as well, one of the things he taught me, because I used to hang out with him when I was in medical school, just trying to learn things. But he always told me, he said, patients know what's wrong with them if you listen to them. Because they'll tell you, he said, they don't have the background. They don't even know that they're telling you, right? He said, they don't have the background, but they understand what's going on with them. If you just sit back and just listen and don't talk. The problem I'm finding today's time is everybody's in a rush. And I've had times where I come behind, and I'll come behind sometimes docs who have interviewed somebody for chest pain, or I'll see chest pain on the diagnosis. And when I go in there, and I just ask them, tell me what brought you here? Why are you in the hospital? My foot was hurting. So I'm like, okay. I'm waiting for, and I just let them talk. I'm waiting for the chest pain part to come out. And I said, well, your paperwork said you were having chest discomfort. I had that 6 months ago, but they put words in my mouth because they were so busy rushing that, it came out. And next thing you know, that became the diagnosis. They never addressed my foot pain, which is why I was here. You see more of that than you care to know because everybody's in a rush. But you have to slow down. And I understand we're all busy. I mean, I get it, but I think sometimes, we're in this technology age too. So everybody's texting, doing all this, that, and the other. But I think if you sometimes just take a step back, let the patient talk. Sometimes you do have to direct them. I've had a few people that would give me a diatribe, a dissertation of things. And so I have to redirect them. But if you let them tell you what's going on, a lot of times you'll figure out the diagnosis before you even lay a hand on them to listen to them. So that's where that's like the young lady was a Tyra, I think it was. Yeah. I think that was her issue. She didn't feel she was heard. And I think they were probably rushing through things and just kind of, blew her off without actually listening to it. And they think, well, she doesn't know anything. She's not a health professional. And they sometimes will to make those assumptions. And I think they're wrong assumptions to make.
Let's see. We can talk to Travis from Norfolk. Hi, Travis. You're on the air.
Hey, Barbara. I love your show.
Thank you.
So my question is this almost a purely American problem? Have there been large studies involving pregnant Black women in other Western countries, in let's say Europe and Canada, and then beyond that, continents like Africa or South America to compare and contrast the difference between the United States and our myriad of issues with the healthcare system and social issues versus those pregnancies in other parts of the world?
Very good question. Thank you for the call, Travis. Who wants to handle this? Go ahead.
It's actually a global issue, but it's more prevalent here in the United States. And because we are this wonderful nation and we have access, compared to the rest of the world, we have access to healthcare, we have access to all these things. For us to still have Black women that are 2 to 3 times more likely to die than our counterpart is just ridiculous.
And if I'm not mistaken, the comparison is to developmental and developing, developed and developing countries. I think they're saying our rates of death are comparable to those of, I hate saying third world because that's such a dated term, developing countries. So in Africa and in the Middle East, I think the comparison is that our numbers look the same, but it really shouldn't because we are one of the richest nations in the world. And so you can probably find high mortality rates in Africa for sure. Black women, there's mostly Black women there, but our numbers shouldn't look the same.
Actually, you can go out of the United States and have a better survival rate than here in the United States. I could go to Africa because they are trained. There are midwives there. There are Sweden where they are having births in the house they're not leaving their home. So you can go out of country and actually, if you're a black woman, you could go out of country and have better odds of having a live baby than in the United States. That is unfortunate, but that is true.
And I think Sweden has some of the best health outcomes because their healthcare system is so much better than ours. See, the thing is, you think about we're the richest nation, but we have the poorest access to a lot of things. So even though I think, again, you talk about the top 1%, have all the money, but when you start filtering that down, the majority of people, it's a myriad of things. The study you brought up earlier, you mentioned about the wealthy black women had the same outcomes. But the thing is, I would need to see that study because I would like to see what the health status of those individual women were starting off with. Example, say they had bad hypertension and never got treated. So is it that the outcomes are bad? What reason
made
outside of that could have been creating
outside
that?
economics?
Yes.
Gotcha.
So that's the thing that we don't know without seeing that.
Okay. If you're just joining us, we're talking about Black Maternal Health with Dr. Lindsay Spiro Robbins, Director of the EVMS Center for Maternal and Child Health Equity and Advocacy at ODU, Registered Nurse Teresita Hammond, Team Lead of the Black Maternal Health Equity Action Alliance Conference, Benita Evans, Chairperson of the BMHEAA, and my co-host for Another View on Health, cardiologist Dr. Keith Newby. Today is membership day for our Another View listeners. Let's check in with Lisa Godley for an update on our $2,000 match. How are we doing, Lisa?
We are doing really well. Thank you, everybody. We're more than halfway toward our goal of meeting our match money, which is $2,000. We've had 4 people call in this morning. I'm not sure if they're new members or they're renewing members, but I did want to thank Lynn Klein from Virginia Beach, John Matarin from Newport News, Conrad Bueller from Norfolk, and we had another anonymous call from Virginia Beach. Over $1,200 they've
fantastic. Thank you so very, very much. And the rest of you, that's time to step up. Don't give me a heart attack and make me wait till the end of the end of the show.
1-800-940-7170.
Even though there are medical professionals inside the studio, we do not want this to occur, including a cardiologist.
Absolutely. But please, we between the hour of noon and 1, so we are 32 minutes actually into the hour, and we want to reach that match of $2,000. Your money is matched dollar for dollar up to $2,000. We know we can go over that because you've done it for us before, Another View listeners, and we want you to become a member. Become a sustainer if you can. Decide on the amount of money that you can give, whatever it is, on a monthly basis. We set it and forget it. And that's what we like to say. So you give us your credit card or your bank account number, however you want to make the payment, and then WHRO takes care of the rest. So become a sustainer if you can. If not, make a one-time donation. But please become a member. You are the reason why we're able to bring you shows like Another View and like all of the other programming that you hear on WHRV FM. So give us a call, 800-940-7170. And I'm going to take us back to this conversation because we are having a great conversation here, and we're talking about Black maternal health. I have a question. I noticed that in much of the literature that I'm reading, they say Black birthing people. Can you guys explain to me what that term means and why aren't we saying women? No, I mean seriously, because I want to understand what the
y'all are in the more professional field than me. It's because it's inclusive language, so it's about the trans community too. So somebody can birth and not be identifying as a woman. So or they can identify as non-binary, but they still are giving birth. So that's why those statistics still exist within them. That's why.
All right. I just see. I learn something new every day, right?
Every day.
Same here.
So tell me some more stories. I mean, because I think the stories of what happens to people is what drives this home. And also, let me start with this because I think I'm going to ask you, Benita, what is the Black Maternal Health Equity Action Alliance. What is BEMA, and how are you guys helping to mitigate this problem?
So BEMA is an initiative of Cinch, and you have those initials, those words too. Again, I'm not using 5 words to describe a system or a program. BEMA is an initiative of Cinch, and we focus on Black maternal health. So we have objectives to share Black voices. That includes families and birthing people, but also to bridging the gap between providers and the community, because there is a big gap there, and the more we learn, the more we realize how big that gap actually is. And so we're just kind of focusing on is the provider accountability is also a thing, and I think, and also to dispel implicit bias, and I am actually the one that advocated for saying dispel it, because at the end of the day, the work is not done until it's done. And that could be a revamping of systems and all of that, but the goal is to focus on those things, and that allows us freedom to pivot, and we're realizing we do have to pivot a lot in this process. We started the work in fall of 2022, and I was one of the kind of founding members of a revamped initiative, so it's something that was revamped into something different. And then I eventually became co-chair along with Takima Carnegie Hall.
Okay.
So we're now the co-chairs. We double up, and we kind of are.
So do you guys go into the community? Do you work with groups? Do you work with healthcare professionals? How does it work?
It's a community-led initiative. So we are all. It's literally providers, individuals. We want more community members. We want more families to be a part of it. So it's mostly led by right now by people who are working either at Centera, or I work at the Up Center. So we have a lot of people who are already kind of doing the work and have a passion for it. And we're just here kind of separating ourselves into different teams that work in different different aspects in the community. So we have a provider engagement team, and so they kind of work and do stuff in the community, whatever that looks like, because right now it's just trying to get partnership with different providers to get more information of like what's actually happening here, because we can't go in with the assumption when we're not a doctor that's providing OB care for families, we don't know what you're actually doing to address these
so
needs.
You're more on the experience side as opposed to the medical side. Is that a fair way to describe that? We're not doing
research like that. We're really trying to engage with the community and do a lot of advocacy work. We work more directly with families and hearing their stories than we do work with like doing training for something.
I got a question. How often do you have women that show up and you know they're pregnant when they're in labor? That's when you find out.
You would know that.
Oh,
Is
that's still a thing.
Yeah.
It is.
Okay.
That is still a thing. It's a rare thing, but it's still a
it
thing.
doesn't happen that often anymore.
Well, the
se.
mind is a powerful thing, I'm going to say, because I can look at you and be like, ma'am, and you can tell me, I didn't even know I was pregnant. And I'd be like, oh, ma'am.
You didn't feel that you thought you were having hunger pains? What?
Ma'am.
I don't know what could have happened.
Right, ma'am.
Something about the birds and the bees. I mean,
Right. So I would just say that I think the mind is a powerful thing, but I've seen like college students come in and they just swear up and down they didn't know that they were pregnant. Some of them look like they don't even look like they're pregnant. And then there's others that, ma'am, stop.
So the reason I bring that up is when you get into maternal health, if they didn't have good prenatal care, that of course is going to impact the outcomes a lot of times. And how, when you talk about being in advocacy, it's kind of like where to even start, because you got to find people to know they need that help. And I know that's got to be a tough job when you're trying to get the word out, but have people take it seriously. Because a lot of people, I found the young people, interestingly, health systems are bad because they don't think they're ever going to be sick. Blood pressure, diabetes, developing heart problems, but then maternal issues. And I'm finding that a lot of people just don't think it would happen to them.
Yeah.
So how hard is it? And where do you even start to know how to get to people?
My job within the Up Center as the family resource specialist is outreach. So Healthy Families as an organization is a home visiting program, early childhood home visiting. One of the focuses is maternal health. So we're focusing on infant mortality and morbidity rates. We're trying to make sure kids are going to their appointments for that gap that they are not in school. So from birth to 5, it's a support that makes sure these kids are getting their wellness checks, their vaccinations and all that. But also in alignment with that for Healthy Families, we focus on maternal health because mamas don't go to doctors doctor's appointments. They're not getting prenatal care, and that puts them and their babies at risk. And it's also a risk factor in their overall family well-being. It's like if mom is not going to prenatal visits and or not going to her well check 6 weeks after, then we already know that there's going to be a lot of other factors that can fall through the cracks, and that puts that family at risk of so much. So we are there weekly with the family, making sure that we're checking in on their mental well-being, we're checking on their physical well-being. Are you going to your doctor's appointment? Are you comfortable with your doctor? Do you have a pediatrician? How do you have access to that pediatrician? And we're helping them coordinate for them. So Healthy Families is one of 7 home visiting programs in Norfolk alone, but it's one of the few within Hampton Roads. It's a international organization. So there are programs that do that. But when I tell you how hard it is to actually find the moms, to get them involved in this free service for them, it's actually really hard. And we've only, because of COVID, we saw a big shift and a big gap in that continuity of connection, because I don't know what else to call it. And the access points that still exist and are only the ones we have are our providers, which are our doctors and pediatricians, and WIC, to be honest, in the Department of Health. So if those entities don't know about what we provide to make it easy on the community, and really to bear the brunt of what exists as a disparity, then we don't have access to those families.
So if someone is listening right now and they want to connect someone to you, how do they do that?
They can go on the upcenter.org.
Upcenter.org.
And there's a strengthening, you can go / strengthening families, but you can go up there and you can search for it. You can also go on -9 to 5. That's an initiative through ODU and EVMS, if I'm not mistaken, and they actually have a direct referral source. So no matter what city you are in, they can connect you to home visiting programs. It's one of their initiatives they actually just started this past year, is really like being intentional about how to easily refer, that providers can refer and that you can self-refer. So that if you're within the Hampton Roads through Isle of Wight, you can connect with -9 to 5, and it's 9 as in the number, 2, 5 as in the number, and that's because where -9 mean that immediately from birth through 5, they're connecting you. They're focused on early childhood and pregnancy, and so they can connect you to the resources that are available. And that's one of the ways that we're really trying to get to the families, because there's no other way.
And I'll tell you, a way for us from the hospital system is we have like Urban Babies is in-house. We have social workers in-house. So when they come in, especially when they come in, I just found out that I'm pregnant. We try to really connect them early. For me, it's all about prevention, right? If I can catch you when you're like 5 weeks, man, we can smooth out that pregnancy. So by the time you come back to have your babies, we've addressed all those social determinants of health. It's about meeting people where they are, which is why we try to offer free childbirth classes. We got free Spanish tours and childbirth classes. It's going out to Portsmouth because that is our maternal desert in this area, and having community days and having the bus come out. It's about meeting people where they are. That one builds trust in the community. Hey, they're talking to us. They're believing us.
I'll tell you, one of the toughest things I found is in our community is trying to get people to take their health seriously. It's like where our priorities are is not on health. And our prime example, and I do like the farmers markets things in the summer, or I do talks at churches or whatever community events. The attendance is not great.
Attendance, right?
Yeah, it's marginal at best.
The people who need to hear it aren't the ones that come out.
Yes, you'll see the same people, the majority of those things, because we just don't value good health. We don't. I mean, and trying to twist that around to how do you get people to take it seriously? And unfortunately, so a lot of times it happens after the bad event happens. Yeah. And even still, you have some people. I saw a guy the other day, had open heart surgery for bypass because, just messing around. And it went through open heart surgery, and he's still bad. I mean, still smoking. He's still, he says his famous last words, well, you gotta die of something. Yeah. And I'm like, but you don't have to die now. But trying to get that piece across, how do you convince people to take it seriously? Because your health is really, you can't do anything
else without your health. That's very true.
What they call cognitive dissonance is that disconnect that they have of like, this is not actually happening. And I think it's a survival and crisis mode instinct. I think it's something that culturally we see a lot with Black people, is ignore something that is probably going to be bad because it keeps you safe and it makes you feel safe. It doesn't keep you safe, but it makes you feel safe because whatever that is could be so much much more, and you don't have capacity for that. So I'm gonna have to stick with what I know, and I'm gonna focus on work, my kids, and we know, unfortunately, Black women are gonna focus so much more on their kids.
Yeah.
Meanwhile, everything else behind them that's actually affecting them physically and mentally is crumbling. And I see it so much in my job is that these moms will they'll have 4 kids, and it's like you are holding on by a thread, and you won't even let us help you because it is so hard for you to say, I got to let go of this thread.
Yeah.
And my kids are going to be okay. Your kids are going to be fine, but they're absolutely not going to be fine in 5 years when you're in a mental health facility or you're dead because of stress. So it's like, that's hard to connect. It's hard for them to feel that because that is unsafe for them.
Dr. Robbins, you wanted to say something. You've been trying to get in the
No,
conversation.
that's okay. We've kind of taken another turn, but it was we were talking about like how do you reach people, and one of the things that we've been looking at is where you live, like, and how much that influences your health. So looking at there's some indices, like if you look at census tract data or neighborhood data, even smaller than zip codes, you can really get more granular, and we can actually link outcomes to the health of the community. And so if we can target those socially vulnerable, or there's a social vulnerability index and then a neighborhood deprivation index. And so if we target those most vulnerable communities and allocate resources there, we may be able to reach groups of people that are more at risk, in addition to the individual outreach that wonderful groups like yours, Benina, are doing, and the individual patient care. Because that one-on-one care is great, but trying to find pockets where we can really have an impact.
Let's talk to Sean Paul in Virginia Beach. Hi, you're on the air.
Hi, yeah, thanks for having me. I wanted to ask, is there potentially a link between the linguistic understanding of medicine, kind of like using Toni Morrison's ideas of the white gaze, how inherently medicine has a lot of white dominated, even within its medical practices, knowing how like infrared technology doesn't even account for melanated experiences with like O2 sensors. Is that also playing a profound effect into why Black women's experiences in medicine are negated or not considered real?
It's funny that you say that. So last year we did our first
Thanks, Sean, for the call.
Conference, and one of the topics that I'll say, like, I think I initiated this topic because it was just something that kind of was boiling in my head, is code switching. Yes. And how it actually is a barrier within the Black community. And I think that's kind of speaking to what you're saying, is that like the language that doctors use and providers use does not match the language of especially Black people, but Black people of specific socioeconomic status, right? And that can play into respectability politics. I mean, because these experience that Black people have is not just with white doctors or doctors who prescribe to more white dominant culture, right? It still exists within. If they have a Black provider, there still is a barrier that they can face. They can still face resistance from those doctors because of a system that is more white dominant, and we can say that out loud, right? And I think so we ended up having one of our topics kind of just allow a fireside chat, a discussion of it, because it was one of those that you just kind of have to understand. Like, and I think, and it's not, there were real research. We couldn't find a direct links of research about this specific topic because I think it's just one of the things we just kind of were twirling around with, whatever. But I think that is a thing. I think that, Black people don't speak the same language, and that's not just verbal communication. I think that's nonverbal communication too. That is systemic, that is cultural belief systems. And I think that also plays out into people's belief systems about Black people. And I think all of that prevents people from being able to engage in the system the same way and receive from a family or a mom the same way. So I think that yes. Personally, I think yes.
Thanks for the call, Sean Paul. We appreciate it. Termasita, tell us about the conference.
It's going to be amazing. That's what you need to know.
She's singing it out. I tell you.
Yes, it is going
So
to
there
be
is a
amazing.
Black Maternal Health Week, and it is
Yes.
April
the 11th through the 17th. We are doing our conference, kicking it off at Norfolk State. I'm so happy that they allowed us to come back. That is April the 10th, and it is filled with wonderful topics. We're going to be talking about the evolution of We're going to be talking about this is not going to help me though. We're going to be talking about that's not going to help me either. We're going to be talking about the evolution of midwifery and doulas and how their role and what do they play. We have that was going to be Dr. Porsche.
Yeah, we did a show on midwifery and doulas, and it was one of our most popular shows. People were just over the moon about that. Yeah.
And then we're going to do some breakout sessions about mental health because, Black mental health. You could do a whole show on Black mental health, right? Because we just act like it's not happening. So we're going to talk about that. We're going to talk about the future of nursing. What does that look like? We're going to talk about grief and how to move forward. We're going to have some fireside chats. We're going to talk about IVF and another stigma that I don't think Black people really talk about is having
IVF,
a hard time.
in vitro fertilization.
Yeah, having a hard time getting pregnant. What are the new things coming out? It's not always about the mama. It is about the daddy too. What? Because we don't talk about
the way
that.
that research is set up, actually.
Man, so I am. Yeah. So I'm just hoping for a really engaging time. We're going to end up with talk about doulas, and Dr. Robbins is going to be there talking about the doula role in the hospital and what does that look like and how we can all come together. It's going to be amazing.
And I have the honor of serving as MC for the Voices of Black Birth in Hampton Roads. That's going to be on Tuesday the 14th from 6 until 8 at the EVMS Lewis Hall on the first floor. Registration is free. Is the conference free?
Yes,
You know it is.
The
I'm
conference
assuming
is
it's
free
April
for everyone.
14th?
April 14th.
Okay.
Did I say May?
You just said 14. Okay.
April 14th.
Okay.
Yes,
14th.
absolutely. It's an evening of celebrating individuals through community and impact awards and powerful stories shaping Black maternal health in Hampton Roads. So lots to go. Where do people go to find out about everything?
Cinch. I would tell you is cinch.org.
Cinch.org.
Yes.
Okay. CINCH.
Yes.
.org.
Yes.
Absolutely.
And that will pull you right to the link of all the events that we're happening throughout the week.
Okay, let me see if I can get one more call in before we believe it or not, we're almost done. Sean joins us from Yorktown. Hi, Sean. You're on the air.
Hey, good afternoon.
Hi.
I was wondering, I just read a study from Duke University about obesity in Black women. 80% of Black women are obese. And I'm wondering how much of that plays a role in one having pre-existing issues before they even become pregnant.
Comorbidities are a thing, aren't they?
Okay, Sean, thank you for the call. Actually, our producer jumped online to double check something, and it's actually 59%, not 80%. But thanks for the call. We hear your point. Go ahead, Doctor.
Sure. I mean, I think that obesity is an issue in our nation for all races. We're seeing that across the board. It absolutely increases pregnancy complications regardless of race. I can't off the top of my head quote you a study on whether obesity impacts Black women's outcomes more than white women. But what we do know is that it raises complications across the board. So it absolutely is something that we need to address as a society if we want to improve maternal health outcomes in the United States, and that can only help our Black patients as well as patients of any race as well.
Absolutely. Tell us about the doulas that you're going to talk about during the conference.
Oh, well, doulas are, we're actually going to have a regroup next week to kind of make sure that we have a good agenda for you all. But the doulas are a wonderful source of support in the hospital. They are not medical, so it's important to differentiate your doula from your medical team. But a doula can be a wonderful advocate, support person, someone who can speak up when you are just like, I think it was Tyra who called in earlier and didn't feel like she had a voice. That's a person that can step out in the hallway, find a nurse, talk to the doctor and say, here's her, let me rephrase, here's what she's telling you and we need you to hear it. And so just having someone else to act as a second second agent, an advocate.
Are they part of the
It's
hospital
wonderful.
system?
No.
these are separate.
community-based.
They're usually community-based. Well, it depends on where you are, actually. I worked in a hospital where the doulas were specific to the hospital, and you signed up for it, and you got to sign one. They had hospital badges. They badged in and out of L&D. So it just depends on how you're set up. I think, where we are at Centera, these are community-based doulas. They do go through a certification process to serve in that role, and then they come for delivery with the patient and their family.
Just out of curiosity, the origin of that name doula, was that stand for something, or is that?
If I'm not mistaken, doula is almost like the servant. It's like a word that means servant because they are, for all intents and purposes, the servant of the mother.
Gotcha.
So they're there as a emotional and physical support for moms. Medicaid provides it when they get 8 doula sessions. So that's the benefit of doulas, is that you've developed a relationship with this person. They've known you while you're pregnant, and then they also can be there through birth and also postpartum, depending on if you have a full spectrum.
So we got about 3 minutes left. I do want to also have you guys speak to the point that while we have a lot of services that are out there, you do not have to be low income to get those services, because this issue crosses all socioeconomic areas. Is that correct? Somebody?
That's correct.
For sure.
That's correct. It's available to everybody.
Like home visiting programs, there are some that have income limits. There are some that, like, there's Fleet and Family that only serves military families, which is beneficial to them because the way their schedules are set up, they need some flexibility that might not exist within another organization. But like Parents as Teachers, Healthy Families, at the Up Center, we don't have income restrictions. You just gotta need support, and honestly, that could look like anything for our families. So there's a lot. WIC, of course, has income restrictions. However, there's their threshold of like income is higher than the threshold for Medicaid and SNAP. So they're a benefit because they also have people that might assist you with breastfeeding. They also do a lot of resource connection as a standard practice for their support system. So, and they also have groups that you can be a part of that don't require you to be receiving WIC, which is why a lot of the other programs are beneficial too. I think the biggest thing is having those access points to know that, like, there's different organizations that if you can't do this part, you can still do this part.
Reach out. The bottom line. Reach out. Get help. No matter how educated. No matter how rich, how poor. Reach out and ask for the help. Correct?
Yeah, absolutely.
Thank you all so much for joining us
welcome.
today.
Thank
We
you.
really appreciate it. I'm ending this a little bit early because I want to go back to Lisa and talk to her about how we did on our pledge drive.
We are so excited in here. We raised over $6,000. $6,482, and with the match, $8,482 in the hour.
Thank you, listeners.
I want to
so much for us.
Shout out 3 quick names.
Sure.
Mary Alice Beal was one of them from Franklin. Thank you, Mary Alice. Joanne Bolts from Virginia Beach, and Mary Pittman says she appreciates you and Keith.
Oh, that is so sweet. Everybody loves Keith, let me tell you. When I'm out in the community, they all like, oh, that Dr. Newby, he's just such a good guy. Audience, thank you so very much. Thank you for all your support. We really appreciate it. And we appreciate you listening to today's show, because this is some important information that you need to know so that you can stay healthy. That is the bottom line. That's why Keith and I do this show every 4th Thursday of the month, so that we can bring you the health information that you need so that you will be okay. And you know what? For the rest of you, it's still not too late to join our public media family. It's called 800-940-7170, or you can go to WHRO.org and make your donation. So even though we reached and exceeded our limit, we want more. We're greedy. No, but the more you give, the more we are able to bring you quality programming, and that is the bottom line. Next week on Another View, Dr. Eric LaVille with perspective on what's happening in the global stage and his award-winning Claville Report. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Jordan Christie is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. You still have time. Call 800-940-7170 and become a member. Let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.